is Focus with Jack Caudill.
Good evening, I'm Jack Caudill. Welcome to this month's edition of Focus. This month we're talking about the Care Campus here in Rapid City. Three guests with us to talk about that. Chief Deputy Willie Whelchel, he is with the Pennington County Sheriff's Office. Director Barry Tice with the Pennington County Health and Human Services. And Clinical Director Heather Armstrong, she is with the Crisis Care, that also run by Behavior Management System. Their little background, the Care Campus is on Kansas City Street here in Rapid City in the old National American University campus down there. It is one of the newest Pennington County programs, started back in 2018. That involves the Pennington County Sheriff's Office, Substance Abuse Program, Pennington County Health and Human Services, Rapid City Police Department Quality of Life Unit, and the Crisis Care Center. Willie, we're going to start with you. I guess, first of all, a quick overall of what the Care Campus is and what you guys are doing down there.
Yeah, thanks, Jack, for having us on today. This is truly the most exciting thing, I believe, to come to the Black Hills in the 30-plus years I've been working in law enforcement here in the Black Hills. It's even way bigger than we ever imagined it. We got a lot going on in this facility. As you know, it's 70,000 square feet, the old NAU building that we were able to acquire. And sitting with me is a couple of our main partners in this. Obviously, it's the City of Rapid City Police Department, the Sheriff's Office, the county, Behavioral Management Systems with the Crisis Care, which is also located in this facility. Quality of Life Unit, which is made up of police officers, 30-plus year officers that wear plain clothes and go out and work on the street with the folks that we serve. And got a lot going on in the building besides all the addiction treatment services, outpatient, the 64 residential treatment beds. There's a lot happening.
Now, Barry, you're with the Health and Human Services aspect of this. As far as your group, what are you guys doing down there?
I always refer to Health and Human Services as the fulcrum of the community. We provide a number of different services, including rent assistance, mortgage assistance, utility assistance, veteran services, and we've expanded over the years to include reentry programming through the Pennington County Jail, as well as our big piece within the building is case management services for those familiar faces utilizing safe solutions, as well as transitional case management for the Crisis Care Center clientele. So it's a very busy operation with multiple programs in one location.
Now, Heather, you're down there with Crisis Care. Can you kind of tell us what is Crisis Care and what is involved in what your part of this operation is doing?
I'd love to, and thank you for having us. Crisis Care Center I refer to as kind of an urgent care for mental health and substance abuse. The most important thing is that we're open 24 hours a day, 7 days a week, and we always have a licensed, credentialed, either social worker or counselor 24 hours a day. So there's always somebody to talk to. It's a voluntary program. We get a lot of self-referrals. When they come in, they get observation services, they get an assessment, and they can spend the 24 hours there for self-care. Sometimes it's just necessary to leave the outside world out and kind of focus on what you need and be in a calm environment with support to do so. So we have 8 beds. We've been open since 2011. Very preventive program, trying to help reduce the amount of people that go to the emergency room or go to what was Regional West, now Monument Behavioral Health. We're kind of a first place that I recommend people stop so that we can see if we can help them first before they need that level of care. And then we work collaboratively with other parts of the Care Campus for resources, getting people the services they need, warm handoffs, that type of thing.
Now, Willie, going back to the beginning, where did the idea for the Care Campus come from, and what was going on or what wasn't going on in the area that made you guys think this is something we really need?
Well, I think in a nutshell, you know, we could talk about this for quite a while, how this all got started, and a lot of folks in our community have been working on this for decades. But what we knew from a law enforcement perspective, the type of what we were doing with our business was not working. You know, it was insanity. We just kept doing the same thing over and over and over again and getting the same results. And what we knew is, and Heather alluded to this, when we're talking about mental health, when we're talking about alcohol and drugs, the jail's not the right place for them. They're not going to get the help they need. They need to be with people who understand that, know how to treat that, and how to work with them. And that's a long-term scenario. And what we also knew is you know, a few years ago before we launched this in 2018, got it built, been working on it since, like I said, many years before that, our correctional facilities were bursting at the seams. And we had a choice to make. Were we going to keep doing the same thing we always did, just incarcerating people? And we were going to have to build another tower on the Pennington County Jail to the cost of our taxpayers $40–50 million. And you know what was going to probably happen? We were going to get the same results. That was not the place that these folks needed to go. They needed to get with professionals. Hence the care campus, the building became available, and then the collaboration in this community. Everybody came together to put this facility together, and I would tell you it's one of one in this size of community, not only in the region, probably in the country, that a community this size put together a facility with all the different efforts that are under one roof, kind of a one-stop shop, so to speak, where they could come and get all the services. What we knew is we couldn't hand them a business card and say, go to this end of the town on Tuesday. They wouldn't show up. What we can do is we can all work together within the building once we figure out what they really need, and then we come together and we start that process.
Now, Barry, as far as Health and Human Services, what was missing that you guys felt there was a need to fill when all of this started to come to fruition?
Rapid City is pretty interesting when it comes to collaborative efforts, and over the years with the Crisis Care Center and with this idea of the Care Campus, in my lifetime of working in human services, I never really thought that I'd share a facility with law enforcement and numerous partners, and you realize really quickly that when you can walk down the hall and visit with other partners to help us problem solve, we make tremendous things happen quickly. And so that's a huge piece to it. Being able to go out into the community as we do with our case management services with the quality of life officers, that provides us an opportunity to meet people where they're at out in the community. And so we're having the same conversations with individuals out in the community as we do when they enter the care campus. So it really streamlines the way we deliver our services.
Heather, as far as mental health care, was there an aspect missing? Did this fill a hole that needed to be filled?
Well, I think as Willie said, you know, crisis care being a standalone program, when we were making those referrals, we were setting them up. You have to drive over to a different part of town, you know, ensuring that they're going to get there on their own. And here at the care campus, it's so much easier for them to access those resources, and we have plenty of programs that are going to ensure that they're going to get to where they need to be. I also believe that there's such a component of mental health and substance abuse, they're dual diagnosis. And so for us to provide both of those services under one roof, I think we're doing the whole complete care for those that access our services.
Now that you're up and running, how busy is the program that you're running, and how do people come to you? Are they referred to you? Do they come on their own? Is it a combination of that?
I'm so glad you asked. We get self-referrals, we get referrals from PD, we get referrals from other agencies in the community, and also other counties. The one thing I feel like is important, one thing that we've learned is it is a single point entry at the care campus, and we've worked really hard to open our crisis care has a front entrance that's all their own. And we just discovered it was a little more comfortable sometimes for those in crisis to be able to enter through the crisis care front entrance. So that is something that we changed and is now in the works. We have those hours of the door opening from 3 p.m. to 7 p.m. Monday through Friday. And that's open to anybody that can just give us a call if you're interested in coming into the Crisis Care Center. And we'll talk to you over the phone, direct you how to get there, and make sure that you have ease of access into our front entrance.
How about Health and Human Services? How busy have you guys been, and how big of a need is there for the services that you guys have?
We realized very quickly in 2020 that the economic assistance became one of our top priorities, and so during that time we definitely shifted our efforts towards economic assistance. And then as we've come back around in our community working on some of the case management services and meeting with our partners every couple of weeks, you know, we realize that there's adjustments that need to be made, if not monthly, weekly. And so it works out very well with our partners to get together, talk about that, make those changes. And so, of course, case management services has now become a priority again as we work through the economic assistance side of things. More individuals are coming into our office now as walk-in traffic as the prior year. So it's going well.
All right, we have to take a break. When we come back, we will continue our look at the Care Campus here in Rapid City when we continue with this month's edition of Focus. And welcome back. I'm Jack Caudill. This edition of Focus, we're talking about the Care Campus here in Rapid City. Willie Whelchel is the Chief Deputy with the Pennington County Sheriff's Office. One of the stated goals for you guys has been diversion, trying to keep people out of jail. How does that work, and has it been working well for you?
Yes, it's worked very well, actually. The whole goal with this, you know, we heard people in the community talking about jail diversion, but what we really seen this was a system diversion. When we talk about our low-level offenders, you know, our Class 2 misdemeanors and petty offenses, them folks were all being taken to the jail. You know, if they were heavily intoxicated or having other issues, they had nowhere to go with these folks. And what would happen is they would go to our jail, which again, every bed was full, plus beds we didn't have. And then they'd start them in the system, whether it's with the state's attorney's office, public defender's office, the court system and all that. And then they'd end up having warrants, and it just kept churning, and we never solved anything. So what we wanted to do is be able to have a place where we could bring these low-level offenders into a facility where they would meet with professionals and we could continue to work with them. So since September of 2018, we've seen about 3,000 folks approximately that have been diverted out of our jail that would have sat in there anywhere from a day to 3, 4, 5 days, coming into our care campus, one point of entry, meeting with an intake specialist, and then working with them. What services do they need? Are we talking detox, safe solutions, crisis care? And these would have all been some type of citation, summons. They would have been arrested, and they went through the system. Put aside the hospital and the ambulance and all the expenses to go with that. And so it is worked very, very well.
So who decides who goes over to jail and then who goes to the Care Campus?
Well, what I would tell you, it's a philosophical shift in our community. So it's all our partners, and you know, and you've heard us talk about it. I can't speak highly enough of the collaboration by everybody in the community wanting to see this work, because ultimately our goal is to change people's habits. You know, we want them to be productive citizens in our community, get jobs, find a place to live, all, you know, what we all want to have, what we all strive for. And so it's all of us working together and saying, okay, law enforcement or whoever's dealing with these folks are not taking them to jail. They're coming to the Care Campus. They're not going to be arrested. Our philosophy is we're going to try and get them the care and the help they need to turn themselves around, change their lives. And so it's everybody working together, made that decision as a collaborative, and that's what's made it work.
Now, you said this is helping people out in a big way financially. What does this do for the county? What does this do for the city?
Yeah, that's an excellent question. As we know, anytime that we buy facilities and remodel them and we staff them, it costs money. We understand that. And one of the things that we said, the sheriff said early in the beginning of this, when we were putting this all together, is that this facility is not going to be a flop house or a wet house or a hotel. What we're going to do, we want to help people. And I'm here to report, we're approximately 3 years into this project, and how often can government say to you, I mean, we're saving lives and we're saving money. And I'd tell you, it's approximately what we've learned in a very short period of time. We haven't been at this very long when we talk about the Care Campus, it being open. We're saving, when we look at the cost to run the Care Campus, we look at the cost to incarcerate people versus the prevention that we are doing with the Care Campus. Right now, we're saving close to $1 million a year, and we're figuring the cost to operate this, and then all the expenses to go through the state's attorney, public defender, courts, hospital, all the things. So it's real dollars in a very short period of time.
Heather, going back to the crisis care and mental health services, what kind of things are you dealing with? What kind of mental health issues do you guys deal with down
Oh boy, that's the best thing about crisis care. We just have such a wide variety of folks that are accessing us, anywhere from you know, those that are struggling on the streets, to those that have been isolated because of COVID, to those that need trauma-informed care, PTSD, depression, you name it. It's a culture, a rich experience for those that work there, just because you're seeing a wide variety of people. So, whoever walks in that door, we're ready to welcome them in and see what their needs are and assess them and help them hopefully move forward.
If it wasn't for what you're doing, would a lot of these people not get care? A lot of them not have care up to this point?
I feel like they would, and one of the reasons that I love the program, and also when it was opened in 2011, it also was one that was very rare in the country, a crisis care center. It's very preventive, and we want people to come there as opposed to going to the ER. We're designed to help those folks. We want the ER to be able to do what they do there, in addition to the cost of them going. So it would be they wouldn't be getting care, or they'd be going up to the emergency room where they would be coming out with a bill. Crisis care is very cost effective, really lots of billing through the state and grants. So as I said, I think it's the best place for people to come first, and we can see what they need. If they need a higher level of care, we're going to help them with that decision.
Barry Tice is with the Pennington County Health and Human Services. What kind of situations do people find themselves in that bring them to look for the services that you guys have there?
We visit with a lot of our community members who are homeless, who suffer from substance abuse and behavioral health needs. And so oftentimes it's just about something as simple as relationship development. And that's really what we focus on. And so we're asked quite often, well, what's your plan for the first time you meet with somebody? And really that plan is just to get to know each other. And it might be as simple as a bottle of water or a pair of shoes or just somebody to answer some questions. It doesn't always mean that it's a financial resource or a physical item. It's just really a basic conversation. And then we start working the process from there. So the term I always use is we're working with human beings and not widgets. And as Heather talked about, everything is different. And so we have that ability. Our caseworkers do a very good job at navigating through each situation and trying to figure out a path forward for the individuals they're serving.
How big of a challenge can it be to get somebody to reach out and admit that I need some help and to come to you guys looking for some help?
That's one of the very unique pieces with having multiple agencies in one location, and also being very innovative on how we promote those services and how we have conversations with individuals about those services. And again, that goes to the point of going out in the community and providing some of this street case management, and especially why we have the weather, which is conducive to get out there, visit with more individuals as they're walking through our town and downtown, and have conversations about the services that are available at the care campus and the really great things we can do to help individuals out when they're ready for that help.
All right, we got to take another break. We'll continue our look at the care campus here in Rapid City when we return with this month's edition of Focus. And I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about the Crisis Care Center here in Rapid City. Chief Deputy Willie Whelchel is with the Pennington County Sheriff's Office. One of the, I think one of the parts of this that people think about the most is the addiction recovery unit that you have down there. What's happening there and how busy is that? Well,
I would tell you that it needs to be more busy than it is. We have 64 treatment beds there at the care campus. Due to 2020 and everything that went on, we had to revamp some things and change some things. We're in the process of gearing back up now. We have approximately 40 beds full. We have both males and females that our counseling staff works with, whether it's in a one-on-one setting or in group settings. So we're gearing that back up to full speed because we truly know there's a need out there. And so we're going to get going on that pretty fast here.
Is meth still the main thing that you're treating down there?
Yes, meth is what we're dealing with here locally, and that's been our main focus with the majority of our beds, and so that's what we're going to stay focused on right now.
All right, Heather Armstrong is the clinical director with Crisis Care. The legislature approved $4.6 million for a crisis stabilization unit. You smile when we talked about that. What is that going to be and how important is what that will bring to you guys?
Just another great thing I think West River is doing. Most of the severe and persistent mentally ill are hospitalized at Yankton, which, as we know, is quite a different distance from Rapid City. So what the investigation discovered is that we needed more longer-term care than just the 24 hours that crisis care provides. So we will have a crisis care center. It will have 8 recliners, and that's 24-hour stay. And then the stabilization unit will be 16 beds, and that is going to be 3 to 5 day length of stay. We also are looking at being an appropriate regional facility, and what that means is we'll be able to do holds, mental health holds, through our facility, and that's going to make a great help for reducing those numbers at the ER and Monument Behavioral Health. That's what we're hoping for. So we'll have this facility that in that 3 to 5 day length of stay, hopefully we'll be able to do medication management, they'll have counseling, they'll have case management services, and a longer term length of stay that we can stabilize people. So I see it as a very necessary development from what we have been doing. It's just upping the game a little bit to help people.
How big of a benefit will that be for somebody who is in crisis and really needs that, to have that here?
Incredibly important. As my 10 years at crisis care, what I've seen is 24 hours is not long enough. And I'm one that has more of a tendency to extend those 24-hour stays. However, you know, we're kind of supposed to stick to the 24. So I think bringing in the 3 to 5 day length of stay is going to make a tremendous difference. And if they're not stabilized in the 24 hours with the initial admission, then we move them over to the 3 to 5 day length of stay. So more services. At this time, crisis care doesn't do meds, so that medication piece is most important.
All right, Barry Tice is the director of Pennington County Health and Human Services. What do you see down the road? What do you see as the future for One Heart, and especially in your department down there?
It's always interesting to watch these programs evolve, and as we touched on earlier, is we're constantly adapting to the needs of our community, and how we've accomplished such wonderful things is through all these collaborative efforts. And there's been a ton of public-private partnerships that really increase the success of this, and we're lucky in Western South Dakota that I always use the example of we can get together in the morning and have a disagreement about something. In the afternoon, we might be sitting in the same meeting with the same individuals discussing something different. And so we're very good at collaborating with multiple agencies in the community. And so it's interesting to look at what we've accomplished so far and just identify these new ways of addressing problems that our community has faced for years.
Willie, got about 30 seconds. What do you see as the future for the place down there?
I would tell you we're going to get more people together. We're bringing more people in to help collaborate. I can't tell you enough of how many people there is behind the scenes that is making this all work, from the inception to the everyday running of the facility. We get to sit up here and talk about how great this is and how awesome it is, but a lot of people are working very hard. We have such an awesome community that's come together, and we're constantly changing, and I think that's important.
One final thing, if somebody needs the help that you guys have, how do they get a hold of the people down at the care campus?
One, they can come right to the door. Like I said, we're open 24/7. All of our services are available 24/7. Of course, they can call the sheriff's office or the police department.
All right, right out of time. Willie Whelchel, Barry Tice, Heather Armstrong, thanks for you. Thanks for joining us for this month's edition of Focus.